And as we continue to follow the latest on the COVID-19 pandemic right here in mid-Missouri, local healthcare organizations are making changes to keep up with this outbreak. We're joined now by Dr. Mark Wakefield, who's an Associate Chief Medical Officer at MU Healthcare. And thank you so much for joining us this morning, Doctor.
Good morning. Thank you.
Good morning. I know this is a very busy time, so we do appreciate your time this morning. And we do just have a few quick questions for you. How is MU Healthcare doing to keep up with the demand of COVID-19 testing?
So we're doing several things at MU Healthcare to keep track of our personal protective equipment, which includes masks, gowns, and other equipment, keeping a good inventory, conserving but protecting patients and our staff.
Very good.
We're taking a lot of efforts.
And so I know you kind of already touched on this, but how else is MU Healthcare operating just a little bit differently in this unprecedented time?
So we've taken a careful look at our operative schedules so that we're only doing surgical cases that have a direct impact on patients, as an example. We're trying to conserve operating room capacity, supplies, protect our staff, but not endanger patients by unwarrantedly delaying surgical care when necessary.
Absolutely. And so how is MU Healthcare supporting its doctors and staff, whether that's, making sure they're okay physically, emotionally, and mentally, just supporting them in this time?
So we had a nice Zoom meeting on Friday where we talked about wellness for physicians, which is always a concern, even in the best of times. We talked about getting good sleep and maintaining a healthy diet and exercise, and I think those principles apply not only to physicians and staff, but all the population.
Absolutely. Getting outside and just getting some fresh air in a time like this can definitely help, when you're feeling a little bit cooped up as well.
But you got to maintain social distance while doing that, which is sometimes tricky on the trail or in the parks.
Absolutely. And also social distancing is a great way to stop the spread of this virus. What are some other ways to do that, just as a reminder to many people?
So washing hands is the most important single thing people can do. Warm water and soap for 20 seconds, which is a lot different than most of us do it. In the hospital, especially among surgeons, that's not a big problem. But to be deliberate about your hand washing is a change for a lot of people.
Yeah. Dr. Wakefield, thank you so much for your time right now. We'll check back in with you in just about 30 minutes, and we do appreciate your time this morning.
Thank you.
Good morning. I know it's a very busy time, so we really appreciate your time, but we'll just go ahead and jump right into these questions. So how has MU Healthcare adapted its clinics to fight this outbreak during this time?
So one thing that we've done that's dramatically different is we've adopted telehealth visits, which can either be from video or telephone. Prior to COVID-19, we were averaging about 150 to 200 visits out of 20,000 per month. And last week we did close to 2,000 video visits.
Wow.
So this is an amazing change, which I think will last long after the COVID-19 crisis. It's convenient for patients, and if you don't need to examine them, touch them, or do a procedure, the patient saves a lot of time and hassle. And we can refill medications and check in on how they're doing. It was really a rapid change, but I think it's for the better in the long term.
Absolutely, and it's kind of like what we're doing right now, except, I'd be coming to you with maybe a medical issue instead of just a lot of questions for you.
Or the way we're holding this interview.
Yeah, absolutely. And we keep hearing the term flatten the curve. Can you kind of explain to us and our viewers what that means?
That's a great concept and why social distancing and hand washing is so important. Flattening the curve prevents the peak surge of critically ill patients saturating the hospital and overwhelming resources. So if, it does prolong the duration of illness in some models, but it prevents people from being unable to access care, for example, in the intensive care unit or the emergency department, because those places become oversaturated. So flattening the curve is a very important model and relies on social distancing and hand washing to protect patients and healthcare workers.
Yeah. And we've gotten a lot of questions here at the station about viewers just asking, how can I help? What does the hospital need? Are people able to make those masks for those healthcare providers for you?
So it's overwhelming, the number of people that have reached out to try to help, and the positive reinforcement to healthcare workers and the dedication and devotion. MU Healthcare has a website with instructions on how to make contact and supply resources. We have to be careful with homemade masks just to make sure that they're effective and clean, and so there's a method for helping with that.
Absolutely. Well, Dr. Wakefield, thank you so much for your time, and give our gratitude to all the healthcare workers on the front lines during this time.
Well, appreciate that. Thank you. Good morning.
Good morning. And so we've heard a lot about drive-through testing. How is MU Healthcare keeping up with that drive-through testing demand?
Well, we've been doing about 200 tests a day through our drive-through, and it's been well staffed. That's a group of nurses and other support staff that have really come together and demonstrated a team approach. I just was listening to the weather forecast, and they've had some bad weather in the last week that they've persevered through. And it's providing a great service, keeping patients away from the emergency department who are not sick. And it's a good utilization of our testing resources.
Absolutely. And now switching gears, talking about more recovery efforts. We know 23 people so far have recovered from this virus just here in Boone County. How have those recovery efforts been for